Hi, I'm Dr. Gerald Minniti, and in this video, I'd like to talk to you about a concept in breast augmentation known as rapid recovery. It's got other names too. You've probably seen it on the internet. Flash recovery, 24-hour recovery. Are these marketing terms or are these real? Well, over the last 2 decades, there has been a technique that is developed and being utilized by many doctors today that involves getting the patient back to their normal daily activities very rapidly, sometimes within a day, but typically within 2 to 4 days. And this is the technique we're talking about, rapid recovery breast augmentation. What is it about? Well, it has to do with an overall planning of the surgery, which actually starts with planning for implant size. Now, I've spoken to you in other videos about dimensional planning and how crucial it is to get a good result with a low risk of complications. And that's the starting point, because we need to have the right size implant for you to get a good result, a low risk result, and rapid recovery. The next part is the surgery itself. The surgery is performed in a way that is exceedingly meticulous and does not allow any excess trauma of tissue, nor does it allow any bleeding of tissue. You would be utterly surprised to know that almost no bleeding happens during the surgery. And what we create is a place that's precisely made in the same shape and size as the implant we want to use. Next, we want to deliver that implant into the position under the muscle, and that's done using a funnel. It's the no-touch technique, as has been described for many years, and it allows me to take the implant from its sterile box into your subpectoral position without touching it, without it touching anything. And it goes right in, and it allows the implant to be properly positioned without being contaminated. Finally, we do rapid closure and get the incisions closed so that the surgery is as short as it has to be, and we do not prolong the surgery. After surgery, in the recovery room, you're going to get a small amount of narcotic medication, which is going to assist you in the next few hours after you leave the surgery center. And when you get home, you'll start taking your first ibuprofen medication. Now, at this point, we have you start doing a stretching exercise, which brings your shoulders back and your arms over your head. We actually want you to stretch that muscle out, and that might sound painful, but in fact it isn't. Patients that do this on a regular basis after their surgery actually find that it makes them feel more comfortable with less discomfort or stiffness. And we have you do that every hour after the surgery during the first day. The next day you come in and I take a look at you. All you're wearing is a very comfortable bra. We don't use tight wraps because we don't need tight wraps. And patients don't have any bruising whatsoever. It's really rather remarkable how little discomfort my patients have after surgery. Most of my patients end up driving a motor vehicle usually within 3 days. And some patients get back to work very, very quickly. So this is rapid recovery or 24-hour recovery. Does that mean you're completely recovered? No, but it means you're getting back to your usual activities and you have the lowest risk of complications. And that's what I want for my patients. I want it to be an easy surgery with a low risk of reoperation.